So our first speaker today is Professor Sergio Sismondo. He is a professor of philosophy and sociology at Queen's University. He's also the head editor of Social Studies of Science, one of the flagship journals in science and technology studies. He's the author of a wide variety of articles on a large variety of topics. He's also the author of 4 books. His most recent, Ghost Managed Medicine, Big Pharma's Invisible Hands, came out in 2018 with Mattering Press, and talks a lot about Big Pharma's influence in the construction of medical knowledge. And there's also free versions on Mattering Press's website, so definitely recommend checking it out. And Sergio, take it away.
Sure thing. Okay, just share a screen here. Does that work again? Second time round?
There we go. Looks good.
Okay, good. Okay, so you asked me to say some very general words, and I'll do that, but I'm going to cheat. I apologize. I sort of thought about general words that I might have to say about socially responsible funding policy from an STS point of view. And I thought, well, it ends up very general, overly general for my taste. So I'll just say some of the frameworks that I have found useful are, and I'm just going to associate them with individual people, even if that's not 100% appropriate. But going back a few decades, Langdon Winner's, more than a few decades, Langdon Winner's The Whale and the Reactor articulated a sort of a temporal issue in terms of funding policy and especially with respect to technology and in general. And the temporal issue is, can we undo what we've done? And I think Winner articulated very eloquently a kind of principle that we should be pushing in directions that we can undo more easily than many of the things that we take on. And so that the reactor becomes the symbol of what is difficult to undo. A few decades later, a book that I didn't really appreciate when it first came out, Bruno Latour's Politics of Nature, but I'm starting to understand it a lot better now, is a book about what we let into our cosmologies. And so this would be, he articulates a very detailed set of efforts that maybe when we think about it in terms of socially responsible policy, this would be really a matter of thinking about the particular entities that get let in and kept out. And so this would make this would make funding exercises extraordinarily complicated and would have to open them up to very wide ranges of people getting involved. But I think that there are some models for doing that, and I could talk about that in the question period. Sheila Jasanoff has this idea of civic epistemologies in which funding becomes one part of the whole process of science. And so it needs to be integrated with sets of especially she focuses on national, but it could be broader than national, but she focuses on national constellations of sort of decision making that in some sense are supposed to cohere. And then Donna Haraway, with missing the Y at the end of her name, my apologies there, doing too fast here, I guess, talking about staying with the trouble. And although that's the title of a 2016 book, she actually articulates this, she creates this phrase a decade earlier than that. And staying with the trouble is sort of the looking for the oppositional side, looking for the places where things are breaking down. And so perhaps we could imagine a funding, socially responsible funding that focused on the places where things are not working, and focused on sort of oppositional strategies. Okay, so these are 4 frameworks that I found particularly useful, but I'm going to cheat because I'm going to talk about my own research. And I will try to do this very quickly. this is a sort of something I've been thinking about with respect to my general research on pharmaceutical research and marketing, with respect to tax credits. So there are extensive tax credits for research. And so here's a sample. This is a little bit out of date. It's 4 years out of date. So for example, the UK's super deduction of 130% that was a special program that no longer exists, etc. And I don't have fully up-to-date information. It's not really too important for my purposes today. I'm sure that some of these super deductions have been replaced by other deductions. This is even for these countries involved, these are federal R&D incentives. And so, for example, for Canadians, it's no surprise that Quebec has its own non-refundable tax credits to try to entice the pharmaceutical industry to work well in the province. So gives us an idea. So this amounts to many billions of dollars of tax credits, and so I think that's important to take into account. So I've been hanging out in the shadows of the pharmaceutical industry, sort of scavenging information, going to conferences, listening to things. And I have come to the conclusion that essentially marketing is everything. And marketing, the American Marketing Association provides this definition of marketing: the activity set of institutions and processes for creating, communicating, delivering, and exchanging offerings that have value for customers, clients, and partners, and society at large. So this is a very expansive view of marketing, and I adopt the American Marketing Association's view of marketing. Basically anything that delivers. So this includes, this includes trucks that deliver things. It includes, but it especially includes for the pharmaceutical industry, a lot of the information vehicles that get things into people's hands and mouths, etc. I have a view of marketing as it's done in the pharmaceutical industry, which might be illustrated by this kind of an image. I was told at one pharmaceutical industry conference that a drug is a molecule surrounded by information. And I think that what the industry does is it pushes some of these things together so that they more or less cohere. And the result is a stable constellation of drugs, publications, physicians, patients, trials, etc., diseases that all kind of cohere together. And once if a company has managed to successfully push all these elements together, then it has a certain stability, at least for a while, as long as, and in fact, the industry can take a light touch after that to sort of managing things. If this constellation works really well, in a sense, the drug sells itself. It doesn't need massive quantities of advertising and such in order to sell. Perhaps a controversial thing I might want to say is that, on this expansive view of marketing, regulatory approval is a key marketing step. And in fact, it is the key marketing step. It is the first step, because nothing in most countries in the world is allowed to be sold without the approval of the national or supranational a regulatory agency like the FDA or the EMA. And this has been the case since the 1960s. So gaining government's approvals for new products has been this crucial early step. And this has been on the basis of expensive research, among other things. The research typically is done by contract research organizations, and 70 to 75% of the pharmaceutical industry's research funding for clinical research goes to contract research organizations. They do the regulatory studies, and they do a lot of the other phase 3 and phase 4, all phase studies that have other other processes in addition to regulatory. So going right back to the origins of the contract research organization. Oh, I apologize about this slide. I took it from another talk. There's a ghostly theme to this whole thing because of, to the origins of the contract research organization, this Henk Besseler argues or claims that the purpose of clinical trials and CRO clinical trials is to get drugs approved. But then we have this sort of, here's another sort of emblematic statement. They are to support directly or indirectly the marketing of our product. I have spent a lot of time looking at different kinds of things such as sponsorship bias. This is from a Cochrane study about sponsorship bias. And what we showed, I was one of the authors on the first version of this. What we showed is that sponsorship is a source of bias itself and should be treated as independent of all other variables. So it's there's a sort of there's a relatively high risk that industry sponsorship produces positive results. 5 minutes, thank you. I know I'm racing and I apologize. One of the reasons for this is because, and I've spent a lot of my early research in the pharmaceutical industry was on ghost, what I call ghost managed publications or ghost written publications, but it's more than just the writing, it's the whole management process of the publications. So for example, this is for a made up drug, although it's very, very closely matching real drug publication plans that I've seen. We see a kind of trajectory here. So this is, as I say, from my early research in the pharmaceutical industry. We see here for a blockbuster drug, they're aiming at nearly 100 publications over the course of 5-6 years. And these are publications that are going in mainstream medical journals. They carry the names of authors, typically academic authors, but they are parts of publication plans. That means that they've been planned, that the research was typically done by a contract research organization. They were the specific outlines of the publication were designed for specific audiences and so on and so forth. So this is not an unusual kind of slide, although it is one for a made up thing. Oh, and this is from a publication planning conference I attended. So here, a publication planner who I skipped the slide in which he says that there's not a PR agency. He says, how are we going to create publications that have the right message and a memorable message for prescribers? As you can see, publication planning is largely about marketing. It is about creating enough buzz in the world to, in the medical world, to sell the product, right? So that's among other things, so large numbers of publications will do that. As I said, these are ghost written. Most typically, the companies do not let the authors get near the actual writing of the manuscript because that would generally produce bad results from a marketing point of view. The authors are key opinion leaders, which is the standard industry phrase. Sometimes you hear opinion leaders, sometimes it's thought leaders. And these are people who are, according to this publication here, people usually eminent, usually physicians who we co-opt into our development and marketing strategies. Okay, so in the interest of time, I'm just going to go back to the tax credits and say, okay, so what's going on here? I'm claiming that just about everything that counts in the pharmaceutical research category is is also marketing, or perhaps primarily marketing. Given that the majority of treatments are clinically ineffective, and I'll defer here to Jacob Stegenga for that, and that the vast majority are no improvement on existing treatments, we might see the pharmaceutical industry as essentially selling dangerous luxury products or risky luxury products. So we might think that we want to, we might want to cut out all the tax credits. Of course, that's not necessarily true. We might, various countries want to support their local pharmaceutical companies simply for economic reasons, and they do that. I mean, I think it's a well-known phenomenon that every country that has a homegrown pharmaceutical company or companies is rather proud of those companies, and they become sort of stars in the industrial stars. So that's one reason why you see some of these tax credits going to research. But I think from the perspective of the frameworks, there are some real issues, and I suspect that I'm just about out of time, so I won't talk about them, but maybe we can come back to some of these issues in the question period. Thank you.